The gallbladder causes the majority of severe abdominal pain and cramps in the right upper quadrant in patients attended to the hospital. The gallbladder can be compared to a balloon which hangs either down below the liver when empty, as you can see here, or stretches as far as the abdominal wall when filled. The gallbladder contains up to 8 milliliters of bile and should empty at least 50% of its volume after food intake. So there's a kind of ejection fraction of the gallbladder too. A healthy gallbladder is almost completely empty after a high-fat meal. In this case, it will be difficult to see. The anatomical structures of the gallbladder are the following. The fundus and corpus is the place where bile is stored for when it's required. The neck is in between the corpus and the cystic duct. The cystic duct unites with the hepatic common duct and forms the common bile duct. So, with the aid of sonography, fundus, corpus, common bile duct are clearly visible. The cystic duct normally cannot be depicted. The gallbladder is bordered by the liver, mostly segment 4, and by the bulbus of the duodenum, which you can see here. This regularly contains bowel gas, and sometimes it's difficult to distinguish between bowel gas and stones in the gallbladder, but for this later on. Also, the head of the pancreas is nearby. In this chapter and the following one, we will discuss the sonographic depiction of the gallbladder and what a normal finding looks like. But we will also describe how gallstones can be recognized, what the signs of an inflammation and of tumors are. A healthy gallbladder is up to 10 centimeters long and 4 centimeters wide. The wall should be examined after the patient has been fasting for at least 6 hours and should be less than 4 millimeters thick. Inside the gallbladder, there is only bile, a liquid without any structures, and therefore the content must be free of echoes. If all these criteria apply, normal size, no echoes, and normal thickness of the wall, we are dealing with a normal finding of the gallbladder. So, let's see. First we check the size. It's 7 centimeters long, 3 centimeters wide, so it's totally normal. We check the lumen of the gallbladder, it's free of echoes. And we have to take a closer look to the wall, so we have to use the zoom function, and it's clearly less than 4 millimeters. So, normal size, no echoes, normal thickness of the wall, it's a normal, healthy gallbladder. In order to find the gallbladder in every patient, we need to have some experience and patience. We will show you a number of ways of examining and some tricks, so that you can be sure to find it. There are various methods of finding the gallbladder over here. Depending on the patient, it will be easy or not so easy. The whole organ must definitely be depicted on the screen. Now, let's go on for scanning. First, I show you in theory how to perform the scan, and afterwards we will see it scanning the model. First, we use the longitudinal subcostal view. Now, place the probe in the longitudinal direction at the midline of the patient and make sure to keep in contact with the costal margin. Transfer the probe longitudinal along the costal margin to the right side of the patient, and on the screen follow the inferior border of the liver for the scanning. Now let's go and scan the model. We will repeat it once more. Diseases of the gallbladder are the most common indications for an abdominal ultrasound examination. Ultrasound can answer the question whether there are gallstones with or without inflammation. And we can reveal complications like cholecystitis, free fluid, or biliary obstruction. So, in order to achieve the best view on the gallbladder, the patient is not allowed to eat anything for at least 6 hours. 6 hours with no oral intake will decrease meteorism and will enlarge the gallbladder. So, also chewing gum, coffee and smoking are forbidden.
Are you ready to perform an ultrasound scan of the gallbladder? The gallbladder can be a rather tricky organ to find sometimes, but Christian will give us some tips and tricks to get a good view of the gallbladder.
So I asked the patient to lay into a left side position and raise the right arm over the head. The first approach begins with a longitudinal subcostal view. I place the probe under the rib bow and keep in contact with the costal arch. So I glide the transducer to the patient's right side and keep an eye on the screen to find this organ. There we see the gallbladder.
Over here, beautiful.
Quite nicely. So,
do you think it's the longest diameter already?
I'm already trying to get the longest diameter by rotating the probe clockwise or anti-clockwise. So I think that's the best view. Take a deep breath, please. Hold the breath for a while. So.
Very nice.
Freeze it, please.
So now we can take our measurements. What is the normal range?
The longest diameter for the gallbladder is 8 to 10 centimeters in longitudinal diameter.
We got 7.3 centimeters here, which is totally normal.
And in the second diameter and in cross diameter, the normal range is 4 to 5 centimeters.
2.6 centimeters here, also perfectly normal.
Now we go for a second view, oblique subcostal view. Scan the center of the liver in a subcostal view, which means you place the probe slightly inferior to the costal margin and press it against the ribs and angle the ultrasound beam under the costal arch. When you tilt the transducer upwards and downwards, you will find the porta hepatis and, in this region, the gallbladder. Let's see this on a patient. The next approach I use is from a subcostal oblique view, where I want to find the porta hepatis, the center of the liver. Please take in a deep breath. And I tilt the probe downwards.
Ready to see here.
To find the porta hepatis.
Here's the portal vein.
And now when we look on the left side of the screen in the near field, we can identify
the gallbladder over here, beautifully seen.
Now the gallbladder is in cross scan, and I can tilt the probe upwards and downwards to check the wall and the volume. When I want to make the longitudinal view, I have to turn the probe 90 degrees clockwise, and I've got another pretty fine look on the gallbladder in longitudinal scan.
So with this approach, you start with a transverse view of the gallbladder, don't you?
Of course. And I prefer this view because the center of the liver, the porta hepatis, is a quite familiar view for us. When we check the liver, we always take this plane. So it's easy to find the gallbladder when you have found this view.
I prefer the other view because I like to make a sweep along the costal arch and orientate on the lower border, on the caudal rim of the liver to get a good view of the gallbladder. That's my preference.
So you can use both of them and decide what's the best for you. So this was not so difficult. The third approach to identify the gallbladder starts with scanning the right kidney in a transverse plane. I will show you on Hippocrates. It starts when we are scanning the right kidney in a transverse plane. While we do so, we find liver parenchyma in the right upper section on our screen. And when we scan the cranial pole of the right kidney, we will detect the gallbladder on our screen.
And we've got a third approach to scan the gallbladder. This time, we start from another landmark from the right kidney.
Please inhale deeply. When we scan the right kidney in cross-scan, we only have to turn the probe slightly to the patient's left side and find the gallbladder over here.
It's here already, yes.
Perfect.
Nicely to see. What about an emergency situation when we can't position our patient and have to get a quick look at the gallbladder? we got a solution for you.
In this particular case, I would prefer the intercostal approach for the gallbladder. So, when the patient lies on his left side, we feel the intercostal space, place the probe in between the ribs, and tilt the probe upwards and downwards. So we will get a perfect view on the gallbladder using this intercostal view. So we can easily detect the gallbladder over here. So I place the probe in between the ribs in this intercostal space and tilt the probe upwards and downwards to find the gallbladder.
Here it is already? Yes. Beautiful to see.
So we can answer the question whether there is a stone or inflammation also on the intensive care unit.
In essence, it's your decision which view you choose. Remember, there are many roads that lead to Rome.
In the next scene, we try to find the gallbladder. We are scanning in the longitudinal and in the oblique subcostal view. We see the center of the liver. The jumping deer can be seen over here. But there is not really the gallbladder seen very clearly here. Now we try in the longitudinal view. Have you already seen it? Over here, this tiny little structure hanging down on the visceral surface of the liver is the gallbladder. Not easy, but we managed it.